Welcome to Cancer and Peace. My name is Sean Stewart, and I'm going to be facilitating a conversation with a world traveler and friend, Peter Scalzo, who's on his 19-year cancer journey for today's podcast. And so welcome back to
thanks, Sean.
the States.
And Jack.
And Jack. Yes, Jack is in here with us. So we're going to talk about we're going to take a turn again today for a direction, and based upon Jack's recommendations. And I don't know why we take recommendations from this guy. So he's too
desperate.
young. He's too young to know anything.
He's too young.
And
but he does know how to do tech and all
and
that.
too educated to know anything also, right?
Yeah.
So I don't know if he's going to appreciate. He's going to put something in this. I think that's going to.
Well, we're going to have him on the show one of these days.
We are trying to get him on the show. So we should have, since this was his idea,
He should have been on this one.
Yeah. Okay, so let's talk about the topic a little bit. And this is something Jack, when we were talking about, he was surprised we haven't talked about this in any big way. Mm-hmm. And there's a little bit of discussion as you came back from your trip, and you had texted me yesterday saying, hey, you spent quite a bit of time in the hospital and you've been in pain.
Yeah.
So you want to tell us a little bit about how you're doing, I guess, because you've been in pain.
Yeah. Well, I'll talk about the physical pain, because Jack was sort of talking about emotional pain earlier. But I think this whole past year, as I look back, it's been a year of fatigue and pain in different areas. Chronic pain mostly, sometimes acute in my leg area. So definitely physical, pain going on. And, I am 7 years on this immunotherapy, and we're not sure if it's from that treatment that's causing it or, other sources. I think one of the issues with my body is I've had so many surgeries that there's a lot of collateral issues that happen with everything that I have been through. But so I'm on this trip with 3 of my kids and nephews and a fiance to one of my kids, and we're in Spain, Barcelona, Spain. Where was I? Barcelona, Spain.
Can't help you.
And Berlin, Germany, and we do this every year. My kids started this. It was sort of a celebration of me living. So around my birthday every year, we take this trip, and this year,
a pretty cool celebration though.
Yeah. Huh. So it's great. We have a blast, and they're young. They're in their 20s and 30s. So I'm the old grumpy guy trying to keep up. And this year I was especially grumpy because of the pain level that I was in. I was just in a lot of pain in my legs, and they really do a trip when they do it. It's 10 plus miles of walking each day, and I was just struggling big time. So when I got back, I noticed I had leg swelling, but I noticed one of my legs was really swelling quite a bit, especially in the flight. And happened to be talking to a doctor yesterday, PCP, my primary care, and he said, I told him what was going on. He said, get right to the emergency department, the closest one, wherever you are. And so I was down in another place with my daughter and Leslie, my ex-wife, and our granddaughter. We were going to the beach, and I had to turn around right away, run to the local emergency department, and found out that my leg is filled with blood clots and causing me a lot of pain. And so started a treatment of blood thinners and that sort of thing. But I think the issue for me, I am really tired of going to hospital settings, really tired. And I try to make the best of it. My girlfriend's a nurse. My daughter's a nurse. My son is a medical student. And, they tell me what they say about patients behind patients' backs and all that kind of things. But I try to be nice and pleasant. I try to make their job better for them. And they did a great job just looking after me, doing a sonogram and all that sort of stuff. But as I was there, I had the emotions were basically I was frustrated, angry, and fearful, because usually blood clots could be a sign of a cancer recurrence going on. And so it was I'm in the hospital. What do I do with those emotions?
Mm-hmm.
So I began to process them in the hospital, and questioning myself, and basically got down to where the place where I get after a while. I don't get there right away, but the place I got to was I'm in pain, Lord, and emotional and physical, really. But the physical pain is tough. And like on this trip, I had to, pop a pain pill narcotic, which was a little bit more than I'm used to doing normally. But and I just said, Lord, I'm not sure how much longer I can do this, really. That was one of the things I said. This is my 19th year on this journey. But then I said, that kind of a decision's not mine to make. And, but I said, there is a decision that I can make. And that is to surrender what's going on to you, and know that you're in charge. And ultimately, I know if I transition, if I pass, I know where I'm going to be. That's a comfort to me, especially in the cancer space, because, it was funny because the doctor and the technician were there, and they're like standing over my bed saying, you have clots all throughout. And I'm like, well, guys, just so you know, I've been told twice to go home and call hospice. So I'm not a stranger to hard news. But I thank you for the way that you're giving me this news. But and I'll be following up with my oncologist and surgeon and everyone else. But just it brought me to a point of, wow, I have had a lot of painful news throughout the process, and physical pain, and I think for me, the point is to get to the place where I can say, okay, Jesus, this is your deal. This is your journey in me.
I find something interesting. I want to.
Yeah.
Well, first, if you haven't figured it out yet, we're talking about finding peace in the pain.
Yeah.
So that's it. You don't need to be sorry we didn't introduce it, but you were. It's
I was
it's
going
fresh.
off there.
It's fresh. Yeah,
Yeah.
That's really good. You and I traveled just 2 or 3 months back, and
Yeah.
you were in pain during that trip.
Yeah.
We talked about it a bit.
Yeah.
And it didn't come up as something we should talk about as a topic, but I saw you dealing with pain.
Yeah.
You were active. You're not letting the pain stop you, but it's something that was interesting. But as you got into your thoughts about your recent experience, because I asked you, hey, what's going on?
Yeah.
And you talked about the pain, but it's interesting to me that you went right into emotional pain. You said, hey, I had to deal with my emotions.
Yeah.
And to me, that's a fascinating thing, because sometimes when we think about pain, the immediate that comes to mind is our physical pain, the actual, my leg, my whatever it is. We go to that, but you worked your way to emotional pain. How do you deal with this emotionally? And it seems pretty important that that's where you went to.
Well, I think for a cancer patient, let's say you're not a cancer patient and you have a broken bone and you're in pain, right?
Mm-hmm.
This is temporary, and they're going to give you some pain meds to help you manage the pain, and they're going to set the bone or whatever, and it's going to be fine afterwards. Like, there's this point at which this is just going to be a blip on the screen.
Mm-hmm.
For me, it was sitting in the emergency department again with potentially life-threatening blood clots, thinking blood clots are related to a cancer recurrence. So it wasn't just let's resolve the blood clots in my mind. It was, Peter, what if? You've been no evidence of disease for some years now, and what does this mean?
Well, you're describing something else that's unique to at least in one sense unique. I guess it's not, at least it's unique to your cancer journey, is that it's not going away. Pain,
Right.
And the ramifications of the cancer journey you've had is not going away.
Right.
That it's going to be there the rest of your life in some manner. And so there has to be a form of acceptance, and like a serenity prayer, accepting things that you can't change. So that seems like that must be one of the things I like about the serenity prayer, is because it ties in with our conversations, accepting hardship as a pathway to peace. And so I wanted to talk about that a bit, because in that hardship, as part of it, is dealing with pain, but I don't want to skip past a bit of what you're saying is that, hey, there is a uniqueness to your situation that is different than a broken bone. Is you do expect it to get better and it's behind you at some point in time.
Right.
And maybe there's stored trauma or something that, the situation can create an experience, but in many ways, that it's not behind you. It's always in front of you.
Right.
And how do you process for peace if there's always pain in front of you?
It's not an existence that I ever would have chosen. And so I have to process it to the degree where I say, Lord, the only way I'm going to find peace in this, if I can accept my situation where it's at. And I ask you for healing. I always ask the Lord for healing.
The reason why I mentioned it, and I'm interested in this, is that when you went through what you've gone through for coming back from this trip, and then you ended up in the hospital, and the fact that you went to the emotional side of things, and I do wonder, it's like it could be easy to go to, I'm going to go to the physical side of things, and then I'm just going to go to physical pain management.
Right.
And there's no shame, there's no condemnation of managing physical pain.
Right.
It's the question about, I just thought it was important that to find peace, you were working on the emotional side. And you said something to me earlier about not letting the physical pain get ahead. And so I think maybe it's probably good to talk about that, just so that people know that we're not in any way trying to speak about medical and, or, telling you, hey, here's how to manage physical pain. But the importance of how do you find peace in the midst of the pain is kind of the conversation that I think we're having today.
Yeah.
And so I heard you starting to talk about a process that you starts at one place. There's a recognition of feeling your feelings, your emotions, then processing them. And then you went somewhere with that. So maybe is that something that you've been learning, and pain's teaching you something, I guess, is maybe the part of the point. And I'd like to hear about that.
I know what pain does for me, and I'm not masochistic. I love to have pain meds and to not be in pain. And so if I'm in the midst of experiencing pain, especially after surgeries or whatever I'm doing, I know that feeling of don't let the pain get ahead of you, and to want to get the pain meds and all that. And I've been in situations where the pain level was 10. And so in those situations, my mind is on, how can I get relief from this? And I have gotten relief. I think that our medical community offers us medications to help manage the pain. And I think that's one misnomer. People think it takes it all away, but it's about managing the pain. But I think, yes, manage the pain and you feel better, right? And so you feel, well, okay, that painful situation's over. Now I'm healing and I'm recovering. I'm going to go back to life, right? But in my situation as a cancer patient, it was, pain is here. Am I just going to go, especially with metastatic cancer, am I going to end up doing an end of life? So it wasn't just a matter of getting through the physical pain through what the medical community offers, but dealing with the fear and the sadness and the anger at the same time. And I was telling somebody, I don't know how I would do it without Jesus Christ in my life. I just don't know how, because I'm able to take those emotions, recognize them, acknowledge them, let them surface, and then offer them up to Jesus and say, Lord, this is a situation that I can't handle right now. I mean, I was really frustrated yesterday, and I was like, I'll be honest, I'm sick of this body, and I don't want it anymore. I don't want this body anymore. And I felt the Lord saying that, almost like he understood, and that it's temporary. This life is temporary. And, that he's entrusted me with this journey.
With this body.
Yeah. And there's a purpose in it. And that doesn't always help me with it hurts right now, and I get ticked. And there's times words come out of my mouth.
You?
Even me.
Huh.
And I'm like, oh man, but I know Jesus doesn't sit there as some kind of a condemning giant. He sits there as let's do this together. I'm going to hold your hand through this. And will you just give it over to me? Will you surrender it?
It seems like that might be part of the lessons that I think, because we're talking about finding peace as some of the lessons, because you just talked about surrender.
Mm-hmm.
And it wasn't surrendering to, pain is going to be beyond bear. It was surrendering something. And I'm curious about that because that seems like the place where peace happens.
I resonate so much with Paul, with the thorn in the flesh, with this journey. That's why I keep talking about it. But this concept that Paul was given a thorn and it was painful, we don't know what it was, right? And I think that's on purpose. And so was it physical, emotional? What was it? We don't know.
Yeah.
But he prays 3 times for God to remove it. And God says no 3 times.
Right.
Right? Because my power is made complete in your weakness, or perfected in your weakness. And I know that, when the pain level's there, I'm like, Lord, I can't do this. I just surrender. I need you. There's a dependency there. It hurts, but it's a beautiful thing.
You said something impactful that's in this vein, and I was curious. We were talking about a friend of yours who was comparing other people to you, and I don't want to get too much details, but one of the things that you stated back was, yes, but I've been on a 19-year cancer journey, and I've had these experiences in my life, and there's something that's been purified in that, and I think there has been a power that's been made perfect in weakness, and so, what that means to me is that something has matured in you because of the pain in this journey, and it was a noticeable maturity this person was talking about that they would like to see in others, and but that only comes through certain doors, I guess, not just one door, but certain doors. And this cancer journey has been that door for you that has created some of that refining fire, perfection and it's not, I don't mean perfection like you've been made perfect, but your inner person is being transformed by that, because of what you mentioned earlier, it's like this, you keep having to surrender over and over. And because it's not just a one and done, the perfection process is being continued on a regular basis.
I mean, my girlfriend, who's a 38-year nurse, said to me, "You're such a stubborn guy." Because she
knows you. Huh.
She's given me instructions and I haven't necessarily followed them. And the message I got, I believe, about myself was, man, you are one rebellious dude. You want to do things your way. And it's interesting because in these places of pain that I'm in, it's that I say, okay, Lord, I can't do it. I really do surrender. If you want me on a different course, let me know, but I can't do it. So it's not, so I think, yes, purification in the sense of being aware of my brokenness and my weakness, and knowing that I can't do it, but God can do stuff in me and through me, that becomes paramount in this whole thing.
Anything practically that you would, because if you're a cancer person listening to a cancer patient, listening to this podcast, and you're starting to deal with pain, anything practically that you would suggest? I mean, I hear this surrender. Is there a process? Is there something in the way that you now approach that you would think that might be helpful for others to hear about as they're approaching, trying to find peace in pain?
Yeah, I think part of the surrendering process is to recognize that there are tools out there that God has put in place through the medical space, community, or other places. And so a lot of times, myself included, we want to grin and bear it, just not have to go and get things checked out and my advice is no, go and get it checked out and start
That's good starting. I like
start a
that
process.
a lot.
Yeah. And that means surrendering.
Don't
Like,
avoid. Yeah.
like my PCP yesterday said, get into the emergency department right now. And the first thing I said to Leslie and my daughter was, I wish I didn't call him because we're at the parking lot at the beach
Yeah.
with my granddaughter.
Yeah.
And I had to leave. I'm like, okay, I'm going to surrender to what he's saying. And sure enough, he was correct. I had blood clots just all throughout my leg, that one leg.
That's so good. Yes.
And so,
I mean, the blood clots are, I mean, your advice here, I think, is such
right.
a good piece of advice. I'm glad you shared this. Yeah.
So I trust my oncologist and my surgeon and my PCP, and I trust them that they have my best interests at heart. Can they be wrong? Of course. But if they emphatically tell me to do a course of action because they know that's what's best for me, can I surrender that God has put them in place in my life to direct my cancer journey? Can I do that?
I'm going to reinforce this, not with a cancer story, but I got bit by a dog last Friday. Not a big deal, but you know, it was a deep enough wound, and my initial insight was like, big deal. I'll just put some, you know, I cleaned it with some alcohol and threw a Band-Aid on it, and but a touch of advice was, hey, you should probably just get it checked out, you know, and have them, you know, have you had a tetanus shot in a while? It's like, no, you know, it's like, I don't want to deal with that, you know, and but eventually, like a couple hours, like, well, I'll go do it. You know, it's like, it's better to be safe than sorry, you know, so I did, I went in and they gave me a tetanus shot and they put me on 10 days of antibiotic because of the potential of the bacteria with the dog bite. And that was good because it's been a few days, but hey, this thing swelled up and the swelling's gone into my ankle. My ankle on the one side is almost twice the size of my other ankle. Now, if I hadn't gone for that, just to do, you know, just go dot the I's, cross the T's.
Right.
Maybe I have a massive infection down in my leg that is a massive problem.
Right.
And because even with the treatment, it's you know, it was enough that it's a problem, you know, and it's not that it's going to heal, it'll be fine. But I was thinking, it's like, that's such good advice. Hey, when there's a problem, go deal with it. Don't ignore it. Don't play, I'm a man, I can just deal with this. It's go deal with it. You know, take it on. It's almost more to deal with that upfront pain is better. It's better to take it head on than to avoid it and then let it fester, I guess is the point. I know it's not a cancer thing, but it just resonates with me. It's like, it was good advice to go get it checked out, go dot the I's, cross the T's, and then it's better to be safe than sorry, or better to begin early.
Yeah, I think it's important this is part of the process we've talked about before, getting a medical team that you trust. I mean, I was in the hospital once and I signed for the first time in AMA against medical advice to leave. But the hospitalist, the doctor on the floor, didn't know all my history and everything. And I knew what she wanted me to do was not necessary. And I checked it out with my team, you know, and they said, yeah, that's not right. So I left. So it's not that they're all knowing.
Yeah.
And you can question.
I think you're right about this too. Yes.
But, you know, I do, like, if I didn't go to the emergency department yesterday, I think that would have been wrong, because it's like, hey, my PCP who likes me is telling me, who's my doctor, telling me to do something, and I'm just going to disregard it and say, no, I'm not going to do it.
That's good opening advice. What else do you have on your thought process? That was good. Yeah.
I think with pain, the important thing is to not let it get ahead of you. And those of you who have been in surgeries or whatever know what I'm talking about, that there's a point at which if you don't take your pain med or whatever, then all of a sudden, you know, the pain level goes from a 6 to a 10. And then it's hard to manage it, because you have to go through the process of getting it back down again. So I think it's that knowledge within yourself saying, okay, I need to take my pain med again, even though I'm not totally at a 10 yet, but it's good because you're staying ahead of it. And these are kind of the practical things I think about pain, I've been in situations after surgeries where I didn't have a ton of pain and other people did who had the same surgeries as me. I remember going around in Sloan, visiting people, and they were like crying and clutching the bed, and I had the same thing done, and I didn't have that same response. So we all respond to things differently, you know. Um, I am empathic towards people in pain because I know what it feels like, and it brings you to your knees.
So you don't do the head down thing like this?
No, I don't do the head down thing. Not that.
I'm sorry. We had a
That's a
conversation
joke.
earlier
Yeah.
where, because I thought this is an interesting.
Yeah.
You say empathic towards people with
Yeah.
pain, and I remember Jean Vanier wrote about meeting somebody on the street who's in deep pain. So they had psychological issues, and they were at a really hard place, and he couldn't enter into their pain. And so when you put your head down and kind of just and you don't look at somebody, it's basically saying, hey, I can't enter your pain. I can't. And there's something about pain management. I think what I like about what you're doing here today, and so this is just a thought into, is like when you share this, I know, we can't share in your physical suffering, but when we can share in your emotional journey, and it's that empathic means you have empathy. It's like, yeah, I can wade in here and actually feel empathy and connection with your story about going through pain. And while I can't feel your feelings in the same way, I can feel your feelings. And I think in a psychological way, we share each other's burdens. And that's because if I put my head down like this and kind of like, I'm basically saying to you, I can't enter your pain with you, Peter. And I think, in this space, what I think you're sharing a bit is, by sharing, you're putting one of the techniques out there is it's allowing others to carry a bit of that burden with you, which to me feels like a really important part of emotional pain.
Yeah.
Is allowing that empathic side to go with you. So
Yeah.
my own monologue with this, I guess.
No, I think that's good. And I think especially with a cancer patient, because pain is a sign that something's wrong. I mean, that's why we have a pain response, right? God built that into us so that we will do something about it if something's wrong. And in the cancer space, a lot of times pain can be something that's really serious from a physical standpoint. And so I think that's where the emotional piece comes into it. And a lot of times what I try to do is surround myself with people who I know are life-giving, because there's life-sucking and life-giving and others, whoever's in between. But I like to...
Can we rate Jack right now just to see it?
No, Jack is definitely life-giving.
Okay, good.
But I want to be, when I'm vulnerable like that and I'm weak, I like to be around people who are life-giving.
Give life, yes.
Yeah, and for me, that's, okay, let's do this a day at a time. Let's do it a moment at a time. I remember when I first got diagnosed with cancer, and I was crying and talking to my mom, and she had her own cancer journey, and she just said, well, we're going to do this a day at a time, a moment at a time. And you really don't know what's going to happen. If 99% of the future for me that I thought was going to happen didn't. I thought it was going to pass so many times, and I didn't. So I don't know what's going to happen. And so the whole fear element, which is part of the emotional pain for me, I just have to give that over to God and say, okay, this is your plan, your journey that's bearing out here.
In my non-life-giving way, I'm going to say, I know what's going to happen. You're going to pass. I just don't know when.
We could say that to everyone,
yes.
Right? Yeah. And yeah, that's the other thing is, I don't know, I'm sure we've talked about it before, but I'm just going to say something, that passing is not the worst thing that can happen to you. That's the way I see it.
Part of the piece, yes.
Yeah.
You mentioned earlier, in this lifetime,
yeah,
pain's always in front of you, but you have a greater peace. That's good. Yeah.
Yeah, and I think personally for me, being estranged from one of my kids, or being in a horrible, relationship that's toxic, some things are just...
That's pain.
Yeah. Worse, really.
Yeah. So, I'm going to be a touch lighter here
Yeah.
for a second. And maybe we should end this on it, because I think maybe one of the greatest tensions that you struggle with is if you do take, if you pop an oxy, it's as if you've taken away some of your revenue stream for what you can sell, and so you have to balance those tensions, right? And
When you say revenue that I can tell, you mean
the oxys, yeah.
oh my gosh.
I'm being funny with you.
Yeah.
You know what I'm saying? It's kind of like this. There's a tension that's really out there. It's different.
Yeah.
So I'm just having fun with you for a
Yeah,
second.
yeah,
It's
yeah,
like
no.
that you actually don't think about that.
No.
But I hear friends talking about it. It's like, hey, you can sell those and you're going to do well.
I don't
So
get many.
That's not a way to manage your pain.
No, I don't get many.
Right.
But, I think that some people are resistant to use pain meds, and I'm always like, hey, if you're in pain, just use a pain med.
Yeah, I think that's one of the messages that you have. That's
Yeah.
where I was actually wanting to kind of just bounce back to is, hey, it's okay
Yeah.
to manage your pain, stay ahead of it. It's one of your messages. More what we can talk about here is really understanding how to find peace in
Right.
by letting your body tell you that something's going on and processing that. And one of the things I hear you really saying is sharing it, because don't go it alone. And you talked about being empathic. I also recognize there's something big that you kind of shared here, and we've talked about a little bit, and is how much it has shaped and grown you.
Mm-hmm.
And that's encouraging when you start thinking about that it's not without purpose.
Right.
And so once you recognize some of those things, I think it doesn't necessarily make you want to have pain, obviously, but it does, in some ways, it's easier to walk through something that has purpose than it is to have. There's nothing else worse. I think we talk about this in recovery, is like wasted pain.
Mm-hmm.
You don't want to have wasted pain. Is allow your pain not to be wasted pain, but to see that it has purpose and let it accomplish its purpose in you, I think is something that's worth talking about a bit.
Mm-hmm.
So I see that's been happening in you, and it hasn't been from just selling the oxys and making.
Just so everyone knows, I barely ever take it. Oxy, I do it only when I'm in really serious pain. So,
yeah. And that's okay.
Yeah.
Yeah. So
on the flight coming back, I couldn't even sit in my seat. So
I can tell I cut you off guard with being too silly. So I was going to make it light.
No, that's okay though. I think physical pain is one of those areas that we don't talk about much. We just want it to end, and I get that.
Yeah.
I get wanting to be done with physical pain. But it is part of the process of dealing with what's going on in your life. I mean, pain is a teacher, right? It's a tutor that something's wrong.
Yeah, and I think one of those lessons, and I see this with you now, and I'll put this out there, it is, and we touched on it here, but you were talking about a lot from your own journey of finding peace and managing pain. But the thing we touched on was part of our journey is learning how to enter other people's pain. And I was thinking about a conversation. It was a few weeks back, and we were in a small group conversation, and this person shared something that was really difficult to hear. And as I looked around the circle with the guys, everybody had their heads down because it was so hard to hear what this person was sharing, and I recognized what they needed was somebody who could look them in the eye while they were doing it, because by looking in their eye as they were sharing something hard, it was a way to enter into their pain. And it's so hard for us to take on more pain. But if I think about my own journey, it's like the more I can process my own pain, which is what you've shared a bit about today, the more I have the ability, there's capacity to take on more pain. And Scazzaro talks about this a little bit with grief and loss. He's like, enlarge your soul through grief and loss is a concept that he puts out there. And I think this is what it means, is as we process our soul is stretched in a sense. And as we process our own pain in our own journey, we've created capacity. And then that capacity gives me the ability at times to look in somebody else's eyes while they're in deep pain. Maybe they're sharing something really hard, and I don't have to put my head down. I can actually I can enter into that pain. I can hear it, And I think that's an important part. What I've seen in your own journey is by you processing your pain. I watch you in recovery and cancer circles enter into other people's pain, and it doesn't cause you to your boat to sink. It doesn't take you to the bottom. It's, in a sense, it's something that's a gift that we get to give to others. And so your life has been that. So I just want to say that now. It's like it's a journey that of somebody who has matured in their pain, and it's allowed you to take on other people's pain and enter into that. And it's a gift that you get to give and that we get to give when we do this. So just some thoughts as we're closing out today's podcast.
Yep. Yeah.
Any last word in this that you want to share before we call a wrap today?
I mean, just encouragement that my faith in Jesus Christ, my relationship in Jesus is huge as I go through this journey.
Yeah,
that's a huge part of it.
Yeah, and in that concept I just put out there, when it's not just processing, it is what you shared early on, and we didn't go a way deep into it, but I think it was a concept. It was, you couldn't do this, you didn't think, without your relationship with Christ.
Right.
And it's because Christ can take that same thing, pain, which as you're processing, is releasing some of that to him is what creates that capacity.
Absolutely.
And so but he has infinite capacity to take on our pain. And so as we're able to do that, we're able to be his hands and feet. I'm glad you shared that, because it's such an important part of this. It's not like processing is like, okay, I processed it like it's a formula or something. It is, no, I actually have a higher power who's able to take on that pain in a way that no one else can.
And I have honest discussions with Jesus. Like yesterday, I was like, I don't think I can do this anymore, kind of thing. Like, I'm tired, and I just benefited so much from being able to be honest with God, with Jesus. And I felt like the message was, then give it to me. Okay, Lord, here it is. And so I'm just going to be pleasant with the hospital staff. Whatever happens, happens. And you're in charge. It is what it is. And I'm just going to go through this and be grateful to you for, I mean, I've been on this for 19 years. I'm grateful to God.
And here you are today getting to share about it.
Yeah. Yep.
So cool.
Yep. Thanks.
Well, thanks everyone for listening.
Yeah, thank you.
Thanks, Peter, for sharing some more of your journey. And so if you want more resources or information, go to cancerandpeace.com. You'll see Peter's book and other resources that we refer to throughout. But hope to see you next time. Thanks so much.